Hi, I'm Kelly Mayer, licensed clinical social worker, and today I'm talking about social anxiety disorder. Social anxiety disorder affects 7% of the US population. The typical age that the symptoms present is between the ages of 8 to 15 years old. And what's really sad about individuals with social anxiety disorder is typically it takes them about 15 to 20 years of having these symptoms before they actually seek treatment. And it's really sad because social anxiety disorder has great treatment, and there's lots of really effective ways to help clients with reducing their symptoms. So you might be wondering, what is social anxiety disorder? And how is that really different than just having a personality where, you're a bit shy or maybe you get a little bit nervous in public speaking? Well, those things are pretty normal, and that's actually not social anxiety disorder. So for social anxiety disorder, according to the DSM-5, the criteria is that these individuals, they have a very intense fear of social situations. They may have difficulties with talking to people. They may have difficulties with speaking up at school or speaking in their workplace. They may really struggle with these interpersonal relationships, with maintaining friendships, with trying to get together and make plans with people. They also typically may avoid social situations. And so, the first main criteria is just this really intense fear of these social situations. They may often feel very embarrassed. They may worry about things like excessive sweating or having their face be, bright red and be flushed in these social situations. They may be experiencing shaking or sweaty palms. So they may then do things like avoid giving handshakes, avoid giving hugs. They may struggle with maintaining eye contact because they're feeling so embarrassed in these social situations and just so scared. They're often really worried about offending others or being rejected by others, and they have a lot of worries about how people are perceiving them. And then these social situations just provoke a very intense fear. There's also a lot of anticipatory anxiety where maybe an individual with social anxiety disorder has some kind of social event coming up, or maybe they have to make a presentation for work or for school. They may spend hours leading up to this event just worrying and just ruminating and just dreading this experience. They may be trying to figure out ways to get out of it, or if they have social plans, they may be thinking about ways that they could back out of these plans, just to try to avoid it because they're just feeling such intense discomfort about whatever the social event is. And avoidance is a really big key with social anxiety disorder. They're definitely avoiding these situations, and also it's causing a lot of distress and impairment in their social and occupational functioning. Now, these fears have to be out of proportion because, of course, everybody typically gets a little bit nervous in social situations like public speaking. But for social anxiety disorder, these fears they're very intense, and they're more than just the average person would experience. Another key criteria for social anxiety disorder is these symptoms are lasting for a period of at least 6 months or longer. So that's just a general overview of social anxiety disorder. Just, of course, to get just a little sense of what it is. If that sounds like some things maybe you are experiencing, then I would just encourage you to reach out and try to find a therapist who specializes in that, because there is really effective treatment for social anxiety disorder. So one of the treatments that we do in therapy sessions is cognitive behavioral therapy. So with CBT, the therapist would be explaining to the client about just different ways of thinking. And a lot of times individuals with social anxiety disorder, they just have a perception that others are judging them. And so in therapy, we try to really challenge those anxious thoughts, and just kind of examine different specific social situations that are causing them distress, and just to challenge our clients, do you really think that people are judging you so much in this situation? And do you really think that people are noticing, that your face is red and that your palms are sweaty and, that you may be shaking? Because in reality, a lot of, to outsiders, they actually don't really notice those types of things. But for individuals with social anxiety disorder, they're so worried about others' perceptions of them. But in fact, the other people probably aren't actually judging them quite as much as they're truly believing in their mind. So that's one thing that we like to challenge during therapy sessions. Then we also do other CBT techniques just to address any of the other worries and concerns about all of the fears that the individual has regarding social situations and just how exactly they're being perceived and possibly judged. Another thing that we do in therapy sessions is we work on social skills. So sometimes people with social anxiety disorder, they just struggle with social skills because they're so afraid. So we work on things like eye contact. We work on things such as how to make conversation, which could be things like, coming up with questions to ask other people in social interactions, or coming up with what to say to others. And things like, maintaining eye contact and, looking at people when you're talking to them, or things like your tone of voice or how you're coming across. And so we can actually teach our clients with social anxiety disorder some of these social skills, and that helps to build their confidence so that they feel a little bit more confident with coming up with examples of things to say in these social situations, questions to ask. Another thing that I do with my own clients with social anxiety disorder that's common in therapy is we do a lot of role playing. So therapy is really great because for social anxiety disorder, they are afraid of social interactions. And what better way to challenge that than coming to a therapy session and talking to your therapist? So your therapist probably will love to do role plays. So if there's a specific situation the client is worried about, I like to do role plays. So for example, maybe somebody with social anxiety disorder is very worried about calling and making reservations at a restaurant. That might be impossible for them. Or they may be extremely worried about making a phone call to schedule a doctor's appointment. Maybe they're avoiding doctor's appointments because they're so scared of not only having to make the phone call, but then going in person and having to talk to the doctor. So those are things that we can easily role play in sessions where me as a therapist, I can pretend to be the receptionist, and we can actually go through the interaction of, what it's like to go ahead and make that phone call and have the client to actually practice. And I do like to work with my clients and try to ask them, like, what do you think you could say when you make the phone call? Sometimes as homework assignments, I'll have them write out a script of what to say, and we'll really break down the task because they're so scared. So we break it all down. We'll talk about it in session. We'll do a role play in session. Maybe I'll have them write out a script as homework. And maybe we might practice it a few more times before they are actually making the phone call. If it's truly something that's just completely impossible for them, I'm never just going to tell them, oh, we'll just go ahead and make the call. We're going to really break it down. And that's something we may work on for several sessions if it is really that challenging for the client. So role plays can definitely be very helpful with clients with social anxiety disorder. Another technique is using exposures. So for exposures, as homework, I may give the client just a set of small challenges. And that's just another example, like with the phone call example, just to go ahead and challenge them to try to make those phone calls if that's what they struggle with. Or for clients that really struggle with social interactions with others, we may spend a lot of time discussing how to make friends, how to meet other people, how to have good conversations with others. And then we may start to break that down and do different exposures where maybe the client has to reach out to a family member or maybe schedule some type of social outing. And we're definitely going to work on that for a long amount of time to make sure that the client really feels confident. It's still, of course, going to be a big challenge for somebody with social anxiety disorder, but I'm going to do my best as the therapist to give them all the tools and all of the discussions and all the troubleshooting so that they can try to be successful in whatever the exposure is. I'm never just going to throw them into the exposure. I'm always going to set them up for success as best as I possibly can. And of course, it's still going to be very anxiety producing for the client. But that's why therapy can be so helpful, because the therapist can actually discuss all these fears regarding social situations, break them down, provide support, also providing encouragement, because clients with social anxiety disorder have probably struggled with these issues for many, many years. And oftentimes they feel very discouraged. And so just having that therapist that you can trust to really provide encouragement and to check in and provide that consistency on a week-to-week basis to ask them, how did the exposures go? Did you end up making that phone call? Did you end up hanging out with that family member? And if so, how did it go? What were some of the challenges when you were making conversation? How did you feel? Did you think they were judging you? Did you think that they noticed how nervous you were? Do you think maybe they actually didn't even notice how nervous you were? And so those are a lot of the things that we discuss in our therapy sessions. Another interesting fact about social anxiety disorder is it's very common for it to also occur with other issues. So the most common issues that social anxiety disorder occurs with would be depression, and also substance abuse. So as you can imagine, somebody with social anxiety disorder typically ends up being very isolated. They may never have any type of dating partner or spouse. They may not really have children because they're not really interacting with others. They may not have very many friends. It may be difficult for them to maintain a job because they're so anxious about interacting with others in the workplace. So typically they end up, unfortunately, being very isolated. And this can lead to a lot of depressive symptoms, and also lead to a lot of self-esteem issues as well. Another issue that people with social anxiety typically have is a lot of them struggle with substance abuse. And this may really be because they're self-medicating their anxiety. So alcoholism is very common with social anxiety disorder. That might be a way that somebody is just coping. It's not a good way to cope, but if you're very anxious about going out to a party and maybe you're drinking alcohol beforehand so that you feel a little bit more comfortable, that's something that is very common with this disorder, as well as some of the other substances. It's just a way that people can sometimes cope. So in therapy, we try to address those as well, because it, of course, is a much healthier way just to go ahead and do cognitive behavioral therapy and work on social skills and to help the client to feel comfortable in these situations with being sober. That's, of course, a much better way to deal with the social anxiety disorder than to just engage in using a lot of substance abuse. And also, over the course of treatment, as the client is getting more comfortable in these social situations, they may start to develop more friendships and better relationships with family members. They may be leaving their house more often and going out to, dinners or social events, or being able to talk on the phone, or being able to speak to coworkers at work. And this is going to greatly improve just their overall quality of life. So for those depressive symptoms, they typically get better over the course of treatment for social anxiety disorder. So if this sounds like you or somebody that you know, I would just encourage you just to reach out to them, let them know that there is help available, and therapy is very effective for social anxiety disorder. And there's a lot of great ways just to go ahead and find a therapist in your area that can help you with these types of issues and just get you on the path to functioning better in your overall life.